Hi, I am Dr.RUkmani Choudhary and you are watching Dr.RUkmani's Health Update. My today's topic is fertility. So I am talking about fertility techniques or we call it ART, Assisted Reproductive Techniques. So in this video I'll be talking about infertility causes in female, diagnostic criteria, ruling out the infertility, ART, that is assisted reproductive techniques. So you are requested to watch complete video for complete information here. If you're watching for the first time, don't forget to subscribe my channel and press the bell icon to get notified. Infertility. See, what is infertility? Infertility is the incompetence to conceive or incompetence to get pregnant after 1 year of your regular basis intercourse and without any protection. So this is infertility, and it can be due to female causes and male causes. So yes, both partners are responsible for this. For female, it is very particular. Why? Because the female are born with the definitive number of the eggs, and number of eggs and the quality of eggs diminish with age. So because with age, yes, there are the complication, and after 30 your chances of becoming pregnant increases with the time, and after 40 it becomes double, right? Yeah, so this is a very important point to understand that yes, female have definitive number of the eggs and the number and the quality get diminished with the age. The causes that leads to infertility. See, this is the main cause, and it can be due to any surgeries or after tuberculosis, after your severe pelvic inflammation. It can lead to the blocked fallopian tube. And the next, hormone regulation. See, there is a hormone, there is a rhythmic balance in your hormone and in your so your egg is released, and there is a harmonic balance. And yes, there is a the thick layer that is prepared in the endometrium for the further progress of the embryo for fertilized egg, so that the progress goes on. But in case if there is a hormone imbalance and there is no proper association, then there is no thickening of the endometrium and there is no further development. So yes, this again causes the infertility cervical problem. If you have any infection in your cervix and there is a discharge and that is not allowed to pass through the sperm, so this again causes infertility. And epilepsy. See, epileptic and seizure female are more prone to having infertility issues. They are even higher at the risk of infertility. Endometriosis. I have already uploaded videos on all the issues like blocked fallopian tube, cervical issues, and PCOD, PCOS, fibroids. All these issues I have covered up. The endometriosis. See, normally your inner wall of the uterus is called endometrium, and these endometrial tissue gets deposited outside, like outside of your uterus, on ovaries, other part of pelvic organ. Then these are called endometriosis, and this is the commonest cause. And yes, it causes infertility. So this again leads to the infertility. Polycystic ovarian disease or polycystic ovarian syndrome. Normally cysts are they are formed and they get dissolved and there is no harm, but the problem occurs when they doesn't get dissolved and there is a deposition. So there is a the cycle problem, menses problem, and that leads to the infertility. And fibroids are again, they are deposition in the uterus, so they get deposited, and again it is not a good medium for the embryo to develop, right? There is no reason for the infertility, and it is called unexplained infertility. Diagnosis. How we diagnose, like these are the female infertility issues. So a blood tests are done and your hormone, all the hormone tests are done, and there is a test that is called laparoscopy. Laparoscopy is effective in your endometriosis. A laparoscope is inserted through your navel with a small incision, and it is looked out that whether there is a deposition on outside of the uterus, on ovaries, other body parts. So it is very easy to visualize with the laparoscope. It is done, and that is HSG. It is done for ruling out the blocked fallopian, and a dye is inserted, and X-ray and USG is done after that. So there is a spelling or not, whether your fallopian tube are blocked, done by HSG. And for diagnosis the exact problem, so we can focus on that particular problem. ART is assisted reproductive techniques, means it is a very good treatment. Like you are given some infertility drugs and some hormone therapies. So this is assisted help with this, and most importantly in clinical experience as well, we see the result in cases who are using some fertility techniques and they are using homeopathy remedies, so they get result. Earlier, unlike the patients who are using only the techniques or only, right? And the patients who are using conjunction, the techniques and the homeopathy medicine, they are getting good results. So you are advised to use both the treatment. They not counteract each other and they even help each other. Called assisted reproductive techniques. So we'll discuss that is gamete intrafallopian transfer, ZIFT, that is zygote intrafallopian transfer, and IVF, in vitro fertilization, commonest one and the successful one. So we'll start with the IVF. IVF is the in vitro fertilization. Means your egg is retrieved and your sperm is retrieved, and they are both mixed together outside of your body, and they are observed for 3 to 5 days. And yes, if there is a good process, they are implanted, and yes, there is a successful results are seen. So this is a very traditional one, very effective one, right? And the next come is zygote intrafallopian transfer. Zygote means it is after the mixing of the the egg and the sperm, they are mixed together and they are fertilized, means they are called zygote, and after 24 hours of the fertilization, means the zygote form, that is transferred in the fallopian tube. This is the ZIFT, gamete intrafallopian transfer. This is the procedure that is inserted, the gamete form is inserted, like the eggs and the sperm, they are transferred just before meeting. So the fertilization takes place in the fallopian tube, right? So these are the some techniques, and they are very effective techniques, and the most successful and reliable techniques is IVF. Medical therapies, in which you are provided some gonadotropin in medical therapy, and egg donation. Surrogacy, you might have heard that surrogacy is the mother that carries the recipient's egg and the recipient's sperms, and the embryo, the baby develops in the surrogate mother, and intrauterine insemination, in which the concentrated sperms are inserted. So these are different terms, and they are very useful, and you should think about it, and you should go over all these, and you should understand what is good for you, and you can opt any according to your requirement. So hopefully this video can help you. If you find this video knowledgeable and informative, you can like and share, and you can subscribe my channel. Don't press the bell icon to get notified. Thank you for watching. Thank you for your support. Keep watching. Thank you.